Are you ready? Okay, fine, then we'll go call to order. Any public comments? I do, now it's time to speak up. No?
I'm good.
You got nothing? Okay. Approval of the minutes of last meeting. How about that? Have you read it?
Yeah.
Have a
Oh,
motion?
yeah, I read them already.
Anybody wants to make a motion to accept those?
Thank you.
Oh, you did, okay.
And I seconded it.
Yes, my mistake. All in favor? Aye. Okay, motion passed. Thank you. Patty, go ahead, your report.
Okay. We have March warrants that total $21,959.53. Payroll is $20,067.33. That includes Chief Carlson's salary of $5,000. Field pay of $2,958.33. Last month, there was one event for each of the commissioners and the secretary. And the total payroll for for the volunteers, warrants included, is $14,536. And your February financial statements are in your meeting books for review. So today we're just looking for a motion to approve the warrants and payroll for March as presented.
Thank you. Any questions, guys?
The training vision was,
Training Division is our online platform for firefighter ongoing education.
oh, and then they just signed in and it's,
That's correct.
Is this a one-time amount?
Yearly amount.
Yes.
So we went underneath the contract with them, so that will probably be our biggest. What was the payment we made? How much?
41.
Yeah, that's the biggest payment out of a 3-year contract. So
out of a 3-year contract.
yeah, so it's a multi-year contract with them. So it'll next year. I don't remember the amount, but it'll be less than the 3rd year. So
Okay. Life assist?
Life Assist is where we get all of our medical supplies, medications, all that stuff.
Thanks.
I move, anything else? I move that we pay the warrants for $21,959.53 and a payroll of $20,067.33.
Okay. Second?
I'll second.
Good. All in favor? Aye. Both motions passed. Okay, go ahead, Patty. Your budget update?
And budget update. As of February 28th, there is 86.18% left in the budget compared to last year's comparison of 82.66.
Good, thank you. Well done.
Welcome.
Mrs. Weaver, you're late for the public comment. Do you have anything to say?
Yeah.
No? Okay, good. No more questions for Patty? No?
No.
Okay. Thanks, Patty, for your time.
Thank you.
Bye.
Bye.
Thank you. Talk to you next month. Thank you. Bye-bye.
Chief, do you know if the bill has been sent to the clinic next door?
As far as I understand, yes.
Okay. And that contract goes from May 1 to April 30th, right?
That I would have to check.
I think it does. That is all. I'm sure we'll get it. If we don't get it now, we'll get it next month. Go ahead, Chief, with correspondence.
And I'll confirm that with Patty. So February, we just received a few public emails and nothing to report within those emails, just general emails. That's all I got. I don't have any cards or anything like that for correspondence.
Okay. Chief, do you have any, are you going to mention anything about the paramedic care team in your chief's report?
I did plan on that. That was going to be mentioned more next month, because April is the month that we hope to put that in place. I can discuss it. I'll just go into it now and then go into my chief's report, if that's okay with the commissioners.
Yeah.
So the community care program, community paramedic care program, is something that's going around the nation, but it's also in Washington State. It's starting to get picked up on. And within that program, it allows us to go out into the community and provide in-home visits and certain level of care and guidance and education and assistance to people who do not have a primary care provider, do not get to their primary care provider on a regular basis, have lost contact with social ability, those types of things. So a number of avenues that we have when we implement this program. Number one, we're going to implement it with advanced practitioners, an advanced nurse practitioner, which is going to be Commissioner Virginia Lester. We're working on a contract right now with Brian Snur that the commissioners would have to approve, and that it'll actually be a resolution that the commissioners will have to approve, and that would allow Virginia to come underneath the organization as a volunteer to produce results or to fit into the community paramedic program as a nurse practitioner. Now that would be specific for that purpose only during that resolution. So she already carries her own liability insurance as a professional provider, but that would bring her underneath the organization and underneath our insurance provider as well. The other thing is Deb Shields is moving back to Point Roberts. She is a licensed physician assistant, and she most likely will come underneath the program as well. She's already volunteered with the organization as an advanced EMT, and I'm speaking with Dr. McBain, who's our supervising physician, about how I can use her and her advanced practice capability as a physician assistant to benefit this organization and the community that we serve. So two things that are happening. So probably in April, prior to that meeting, that resolution will most likely be given to you so you can all read it. Virginia would have to abstain most likely from that resolution because she's going to be the reason for that resolution. So that's where we're at there. The community paramedic program, again, we're offering for free. There was an email request this month by Pat Grubb of the newspaper. I sent him a response, which you all were copied on that response, to explain the program and our rights within that concept of a community paramedic. Now, we're leading the way in Washington State. I don't believe there's any other programs at this time. Kent Fire, we associated with Kent Fire's community paramedic program back in 2014. And they have now become Puget Sound Regional Fire Authority, I believe is their new name. And their community paramedic program has grown leaps and bounds. And they have contracted with nurses to be part of their program and to provide different levels and higher levels of assessments and care out in the field as well. I would have to find again, but another part of the nation is actually having nurse practitioners on their community care paramedic program. And their ambulances actually say NP1, NP2 for nurse practitioner 1, nurse practitioner 2 is their call sign. And I'll have to, again, it was in an article that I read, but I'll find out, hopefully, and be able to find it again where that's happening. So, nationwide, we're not the first. Sorry to say. I'd like to be the first on using advanced practitioners. But I also see this being something in the future that is more evident throughout the fire service, that we start partnering with more advanced providers, including physicians, that most likely will be able to go and start doing what we consider to be house calls again, like my father used to do, and like you used to do, Virginia, when you started your practice too. Just to remind people, Virginia has full authority to stick up a business sign in her front yard and open up a nurse practitioner's office in her home if she would so choose to do that. We're wanting to do this at no cost to the public, And we're doing that because right now we think we're going to have a small volume of people that may take advantage of this. We have already been approached by at least a half a dozen people within the community who will be using our services. And those people right now are they really have no medical care or direction. So our goal is not to provide primary practice in this program. That's not the goal of the Community Paramount program either. But most likely to come into somebody's home and help navigate or be the median person to help them get involved in some type of health care. Whether that be with Unity Care next door, with a family practice physician group down in the county, or the senior, what's that called, Virginia? The Senior Services in Bellingham. Senior Services in Bellingham, which is a great place for senior citizens to go and receive medical care. So that was all stated within the email that was sent to Mr. Grub of the newspaper and explained. The other thing that is our hope is to help people stay in their homes. That's the guidance here, not to have to go into assisted living or into a nursing facility, but to stay in their home as long as possible and to have that outreach, to have that support within the community, whether it's through this organization or others, such as Circle of Care, which we will be adding into our offerings for these individuals. It's another group that's been established here that's going to have the availability to come into and ability to come into people's homes and help them with just daily activities, if I understand their services. This is something I think we've been missing for a lot of years, and a lot of people have had to move from Point Roberts because as they get older, they do not have that support structure. Also, these individuals may not know the programs that are in effect in the county, state, and even at the federal levels that would provide them services that other parts of the county are getting in states as well. My total belief is that living here in Point Roberts, even though our geographical area is challenging, every citizen that we have here should have the same resources available to them as somebody that lives in Blaine, Ferndale, any other part of the mainland or considered Whatcom County. And I don't think we have that right now. We do have some excuses of services that can't get across the border because they don't have people that have valid passports, or it's just considered one of those white spots on the map that is a no-go area for some organizations. But my challenge is going to be to help those social services, senior services, adult protective services, all of those services to understand where we are. Our taxpayers pay the same taxes for these services and therefore should also receive the services and not be left out in the cold. So hopefully we can bridge some of those gaps through this program, help people that do not want to have a primary care, try to have better health care as well. So Virginia, do you have anything to add to that?
I did want to underline this, that we don't want to replace anything that has to do with the clinic. This is not a replacement for a clinic. This is an extension of services to help people in the community who don't have any other way of getting.
Right.
And so these are not, and anybody who is a clinic member would certainly be available, and we could take care of them.
Absolutely.
And get them back to the clinic again for care if
Sure.
they needed to be. So that needs to be really strongly.
Yeah, and that's something that we've stated ever since our first meeting with the hospital district board. We were very upfront with that board when we had our meeting, and exactly that is what we stated. There's no replacement, there's no competition here. It's in addition to, in order to provide more services to this community, and not just have one avenue of the ability to get back into a medical system or a medical practice, or to have some type of medical assessments and then have the assistance needed to gain access to the medical providers. And that's what we hope to be able to do. And again, we're offering it for free at this point. If we get 100 people, I stated this at the hospital district's meeting as well, if we get 100 people, 200 people, I don't know where that line is going to be, that it may overwhelm the organization, but at that point we would have to hire somebody to manage that program and to be more of a consistent, because we still have jobs to do. I still have a job to do the paramedics here. So we will be running 911 calls. If we get too busy, then we may have to hire somebody in and then start charging insurance at that point. But until that day comes, we are not planning on billing any type of insurance and associating any costs with the services that we're going to have.
If these costs and stuff before we hit the 200 mark or whatever it's gonna be, will that be coming out of our budget or how's that handled?
Yeah, I don't know what the associated costs would be. I've looked, and for supply purposes, we're going to have a computer, we're going to be using the reporting system that we currently use.
Yeah.
So, I mean, if we do wound dressing or something like that at somebody's home, if the story that I told Mr. Grubb from the newspaper was I was approached by a community member who had a friend or family member that had to stay in a nursing home for a month to get daily antibiotic infusions. And this is something that could easily have been done at home here in Point Roberts with the understanding of their primary care physician and working with us, that we could have provided those daily infusions to that individual. If that's the case, then we will have to go ahead and purchase an infusion machine. And there would be a cost to that. But when the cost compared to the benefit that it's providing somebody in the tens of thousands of dollars that it's saving the insurance company and or thousands of dollars it's saving the person themselves, I think that's overcome very, very quickly in the cost benefit.
And how does the visitors to Point Roberts from across the border, that are here during the summer, needs these types of services, are they available to them?
Yeah, we would provide them just as if we had a resident here. What people don't understand is that we pay the taxes, right? You pay the taxes to have this organization in place and the services that we provide. You pay the taxes to have the Parks District in place. You pay taxes to have the hospital district in place. All of our services are open to everyone that crosses this border. It's just not the taxpayers. Someone that crosses the border that's Canadian, that's not a U.S. citizen, or they're from whatever country, and they need assistance, they call 911, and we give them the assistance as if they were a resident tax-paying citizen. That happens in Canada. If I'm there, I get the same services as somebody else. If it's a non-emergent situation, I may have to pay up front in Canada, just like I do down in Mexico when I get hurt. But here, everybody gets the same benefit, right? Whether you're a taxpayer or non-taxpayer, everybody receives the same benefit. So a non-taxpayer could come in the clinic and pay cash for a service if they wanted to do that. And the same goes, everybody enjoys the Parks District and everything else, and they don't have to be a resident or tag in somewhere and say, I'm a U.S. citizen to utilize this property here in the taxpayer in Point Roberts. So that's what a lot of people don't understand, is our services are here for 100% of those individuals inside our boundaries.
Makes sense to me. How about you guys? Yeah? If I may, just one short comment. I think I speak for my other two commissioners and I say that this board is firmly behind, firmly behind this new venture. I think it's absolutely beautiful. I think it is well needed, it will be well received, and it poses absolutely no competition to any other organization in town here. The hospital district, which is open, the clinic, which is open basically 24 hours a week, or 24 hours a week, cannot say that we are a burden to them, because they're open 24/7. Every day of the year, every minute of the year. And if we can provide assistance to anybody who needs it, we will give it to them. And that is a darn good step ahead for this fire department. Of course, we all know that EMS calls are way, way, way ahead of fire calls. What a beautiful way to help other people. And I think Chief Calder should receive a nice pat on the back for his initiating this program. I'm proud of you that way.
I'd like to add to that. Again, we associated with Kent Fire, who was creating the CARES program, and actually worked with the legislators and got the legislation passed along with Snohomish County Fire District 1, now South Snohomish Regional Fire Authority, I believe. So we associated with them back in 2014. So this has been on my mind since 2014. We just did not enact participation in their program at that time. Other things came up and time flies by. So now, Bellingham's been running a community paramedic program for, I believe, the last 2 years, if not more. And because of their demographics, it's completely different than the program that we're implementing here, because their program concentrates on the high users of the 911 system that burden the ALS system, the medic units, in the system. So here we don't have that. Years ago, we did have somebody that would call us probably 50 times a year. One person was using our services, 50 times a year. That person has since passed. But we were called out for a multitude of reasons. To get her a glass of water, candy, to run to the grocery store for her, and she was utilizing 911. Now, that would be the type of person that this system would benefit, right? But again, our system is designed to provide a higher level of service in regards to our needs within this community and the demographics that we have. Again, this is most likely, hopefully, going to benefit the clinic in the auspices that we might have people interested in becoming patients of Unity Care. Now, it's their choice if they want to become patients of Unity Care, or they want to become patients of the senior services down in Bellingham, or a family practice office somewhere off point. I believe there is some feeling that there's privacy issues for people being in a small town like we are. And again, I grew up in a town of 700 in Colorado. So I fully understand the small town environments and the politics that are involved. But we utilize this fire district. I utilize the clinic. I utilize the clinic for my blood draws, but I have a primary care physician down in Bellingham. We also send all of our people here, worth thousands of dollars a year. We send all of our medical physicals to the clinic. We utilize the clinic and we support the clinic in every way that we can. And this program will probably, hopefully, be part of that and be able to get some people that haven't thought of the clinic as being a primary care provider or a resource that they can utilize in addition to their primary care provider that they may have down in the county. So that is a hope, but it is ultimately the right of the individual to make that choice. But that's one of the offerings. We're going to be offering the Unity Care as a location for primary care. We're going to be offering an associated family practice as well down in the county, and also the senior center. We're going to develop relationships with all three. We already have a relationship with Unity Care. So my hopes is that this can separate us from other communities, not only in Washington State, but around the nation, and show people what is capable to provide to their citizens and to help their citizens stay home for as long as possible, and until they choose to go somewhere else.
Okay, thanks, Chief. Your report.
Chief's report for March 2018 for the month of February. So this, number one is the same. AFG submitted for the Regional Cardiac Monitor grant. That grant is worth $730,000. It's a regional grant, and what a regional grant means is that we are partnering with 4 other organizations in the county. We've partnered with District 14 in Sumas, ourselves, Ferndale Fire, or Whatcom County Fire District 7, and the Bellingham Fire Department to purchase 18 cardiac monitors. And those are the LifePak 15s, the gray machines that I've shown in previous meetings. And we haven't heard anything. They're still going through the review process. The other thing I submitted a grant for was an SCBA fit tester. The fit tester is dynamic and absolutely a factor in our ability to fit test our firefighters to make sure that their SCBA masks fit properly. Ours is now obsolete, and there's no software to upgrade it. So we have to go out and purchase a new one.
Chief, is the software obsolete or the apparatus? The mask or?
Yeah, they don't have the software to upgrade it to support our system. And John, Assistant Chief.
You and I talked about that last month, I remember.
Yeah. So that puts it into an obsolete position for us, and if we don't get the grant, then we're looking, I don't remember what the grant was, I apologize, but I'm thinking around anywhere from 5,000 to 8,000, I think is where I put the grant in for. I'd have to review it. But I'm hoping that we do, because that is an absolute necessity that hopefully AFG will recognize and provide us the money to purchase. I've been talking about smoke detectors and the smoke detector program that we have. We only have a few smoke detectors left from the state program that provided smoke detectors probably I'd say 4 or 5 years ago. And we got 100 smoke detectors from the state at that time. Again, we've put in all of them except for maybe less than a dozen now. And I'm very happy about that because we've been able to make some homes here in Point Roberts a lot safer. The one item that has been shown to save lives in structure fires is a working smoke detector. Something that has both battery backup and preferably it's hardlined into your home's electrical system and then has a battery backup. So I want to let the public know that that's a free program we offer as well. Here within Fire District, we have since 2012, 2013. And right now we're running low on smoke detectors. So I can't guarantee that I will, but prevention grants are due by the 16th, so Friday. And I'm hoping to get in a prevention grant for smoke detectors, for 100 smoke detectors to be provided through the AFG program as well. And hopefully I can get that grant done, but I can't guarantee it. The other thing we're looking at is American Red Cross. They actually provide free smoke detectors. And I've discussed with them on providing us the smoke detectors so our program, we can go out and install them ourselves. I think we do have a good relationship with the Red Cross, even though that we've had some disagreements with the trailer in the past. But I believe that for this community, and any community, having access to free smoke detectors is vitally important for survivability during a structure fire. So I'm hoping that the Red Cross will be on board with that and be conducive to making a relationship with us and providing us with smoke detectors when we have those calls from citizens. So we'll be doing a smoke detector campaign this summer to see how many houses we can get done.
Okay.
Nothing to report on the apparatus except 858 is going to have to go in and get the engine repaired. So 858 is our primary transport, and I've spoken this before. I'm just reminding you that it has an oil leak that's not getting better, and that was noted and found where the seal has been breached on the engine. So we're going to need to get that fixed at some point. But I can speak to you more about that at the next meeting or after this meeting if you have any questions. Member roster, 45 members. We added 2 firefighters. So we have 25 Canadians, 11 Point Roberts members in 9 county. James Evans is a member of this community here, and he has started fire school down in Texas. So he's been responding to all the calls with us. He's been really good at this point and coming to the calls and going through his fire training. Tavin Jackson will be coming back on the 16th, if I'm correct, from his training in Texas. And hopefully he'll be bringing with him his credentialing at the IFSAC level, international level, in Fire 1, Fire 2, and hazmat operations. And then he'll be a fully certified firefighter for this community. And Tavin Jackson lives here as well. So we do have a person going through fire training at this time. Volunteer hours, 2,261. Volunteer payroll, if all volunteers got paid, 15,081. Combined chief hours, I worked 114 hours, and Assistant Chief Shields worked 139. Total chief hours, 253. So just to let you know, I'm full-time contracted at this point. So that means I took 46 hours of vacation time last month to enjoy my time in Mexico with my wife and my friends. And I still am holding some of the tan that I had from Mexico. It's starting to dissipate a little bit. But it was wonderful, and that's the first grouping of vacation hours I've taken since I became chief in 2012.
Was it a good vacation, food-wise, did you have a problem?
I knew you were going to bring this up. Okay, I'll tell the entire world.
No. That's too quick.
I ate some salsa. I like hot stuff. But this was habaneros, and I've eaten plenty of habaneros. But this was more of a habanero paste. And it was orange, yellow, and it was on the omelet area within our resort. And they make, omelets for you. And they have pico de gallo and green sauce, and then here's this habanero and a couple other ones. And I'm like, okay, well, I'll try it. So I lost all taste in my mouth, and I was weeping at the breakfast table with two of my friends. And I had some GI issues after that for about a day and a half. After I lost all taste buds in my mouth, I drank all the milk that was at the breakfast area, and then had to go milk the goat in the back to bring back the milk for other
Where
people.
was a goat? Not a dog?
It was a goat. And it was the hottest stuff I've ever eaten in my entire life. And like I said, we put red peppers, we put Reaper pepper, which is the third hottest pepper from the Carolinas, I think, or Tennessee right now. My wife and I really like hot stuff, but this, I don't know what was in it. And it should have had a warning on it from people that followed me, because they saw I drank all the milk. But that was my experience in Mexico. It did not ruin the entire trip. It was still a wonderful trip to have with my wife and our friends. So, good trip.
Well, maybe we'll have something else to report next time.
Maybe.
Maybe.
Hopefully nothing like that. But I can guarantee that the gum I swallowed 20 years ago is no longer in my bones at this point. Incidents, we had a total of 11 calls in February. EMS calls, we had 8. We transported 5 to the hospital. Airlift Northwest took 0. No transports, we had 1. And a home visit, we had 1. And then Ferndale took 1 from us. Public agency assist, we had 1 law enforcement request. We had 2 fire classifications, very low on fires last month, which is great because I really appreciate people burning legally. We had 1 permitted burn that we got called out for just to check on, and we had 1 false alarm. And that completes my chief's report for
Thank you, Chief.
Whatcom.
Okay. When we go on to this business. Anybody? No? Anything on new business? No. Okay, then we'll go to executive session. If I can have a motion on the floor, we go to an executive session, I'd say 20 minutes tops. Discussing the job performance review for the chief.
I move that we have an executive session to discuss the performance of the chief's report.
Second, all in favor? Yeah. Okay, there we go. Well, now we'll be back in 20 minutes.
See you later.
We haven't taken any action.
Are we back in session?
Yeah, we are.
Okay.
We haven't taken any action, there was no need to take any action. And if I may phrase it this way, guys, if we want to make comments later on, individually to the fire chief, of course we can do that. We all have different opinions. And if you want to express those privately, go ahead.
Sure.
Well, I think we're pretty happy with the results. Anyhow, good. Motion for adjournment.
So moved.
Motion passed.